Ever feel like you're facing a decision so huge it's got like the weight of the world on your shoulders?
Yeah.
That's IVF for many people, right?
Yeah.
And then throw in this choice about embryo genetic testing, this PGT-A.
Right.
Adds a whole other level, doesn't it?
Absolutely. And I think, a lot of people, they kind of see PGT-A as this like surefire way to have a healthy baby. Like it's going to guarantee that and increase their chances with IVF. But like you said, it's not that simple.
Not that straightforward at all. And that's why we're doing this deep dive. We're looking at Malaysia specifically, where those decisions about whether to use PGT-A or not get even more interesting.
They do, yeah. What's so interesting about Malaysia is the cultural context, I think. So, this decision of whether to use this technology or not is completely intertwined with people's religious beliefs, with expectations of them from society, even legal ambiguities as well.
So it sounds like in Malaysia, the stakes are even higher when it comes to these PGT-A decisions.
Yeah.
What are some of the things that make it so different there?
It's a very tricky situation because you've got the legal landscape. So abortion in Malaysia is very much a gray area, particularly when we're talking about, a fetus that might have a genetic condition. So that uncertainty is incredibly stressful for a lot of families and can lead some people to feel like, well, they could just have some certainty,
Right.
If they could know in advance through something like PGT-A, that would be easier.
It's almost like they're trying to get ahead of any potential issues that might complicate things farther down the line.
And that's where I think the religious aspect also plays a really, really key role here as well, because obviously Malaysia is a deeply religious country.
Yeah.
And for many, many people, the idea of abortion is just morally unacceptable.
Right.
So there's that added pressure to ensure that, if they do conceive, that it's a pregnancy that's considered to be healthy.
Right.
At least from a societal religious perspective.
So it's not even necessarily just about your own personal views.
No.
It's about the expectations of maybe your community.
Absolutely.
And your faith as well.
Exactly. And unfortunately as well, there's still a significant stigma in Malaysia surrounding disabilities. Support systems are often limited. And that, of course, adds another layer, another level of anxiety, really, for parents.
Yeah, absolutely. It's heartbreaking to think about.
Yeah.
Families who might be dealing with those challenges feeling like they don't have anybody to turn to.
Yeah. And we can't forget as well, there is a rising awareness, I think, particularly among educated women about the age-related risks as well. So more and more women are delaying motherhood.
Right.
The desire to kind of minimize those risks through technology, through something like PGT-A, becomes a very big pull.
Especially as families are getting smaller now. There's so much focus on each child and their well-being and their chances.
Yeah.
So it's almost like all their eggs are in one basket.
Yeah.
And they want to make sure that one precious child has every chance.
Exactly.
There's just so much to think about, when it's decisions like that influenced by your own beliefs and what society thinks and everything else. But for a moment, I want to kind of put a pin in that and think about the science for a second.
Okay.
So we talked about how PGT-A is often presented as this way to increase your chances of success with IVF.
Yeah.
But what does the research actually say about that?
Well, that's where things get a little bit, a little bit interesting because I think for a long time there was this assumption that, if you do PGT-A, you are significantly boosting your IVF success rates. But more recent studies have really challenged this.
Oh, really?
Yeah.
So it's not the sort of like foolproof guaranteed thing that some people might think.
Exactly. And there were several, large-scale clinical trials. There's the ESTEEM trial and the STAR trial, and these involve thousands of participants. And what they actually found was that there was no significant improvement in the live birth rate for those who underwent PGT-A compared to those who didn't.
So no real difference then?
No real difference.
The two. That's interesting, yeah.
And it goes even further than that because a 2021 study from China, which was published in the New England Journal of Medicine, showed very similar findings, no significant improvement with PGT-A. And in fact, some studies suggest there might even be a downside for some people. For example, there was an analysis done of a really massive database. It's a database from the Society for Assisted Reproductive Technology. And this included data on over 130,000 IVF cycles.
Oh, wow.
Huge. And what they found was that PGT-A was actually associated with a lower cumulative live birth rate.
Hold on. Lower. What does cumulative live birth rate actually mean?
So cumulative live birth rate is the overall chance of having a baby over multiple IVF cycles. So let's say, a couple undergoes 2 rounds of IVF. The cumulative live birth rate would consider the babies born from both of those cycles, not just each one individually.
Right. Okay. So it's looking at the bigger picture rather than just one isolated cycle. But even then, it just seems counterintuitive that a test that's supposed to help you could actually potentially lower your chances.
It does, and it's actually particularly pronounced in women under 35, who are often, considered to be ideal candidates for IVF, and yet in some cases, what it seems to be is that discarding embryos based on the PGT-A result may actually be lowering their overall chance of having a baby.
Right.
So, yeah.
So if it's not this kind of like guaranteed way to increase your chances, are there any risks involved at all?
So there are potential risks to be aware of, and I think one thing to remember is that to actually do PGT-A, a biopsy of the embryo is required.
Okay.
So that means they have to extract cells for testing, and that can be quite invasive.
Yeah. That sounds kind of risky, really, when you think about it.
It can be, and particularly for lower quality embryos, which obviously are more common in older women. And, a lot of the studies that claim that there are no ill effects from biopsies, they've often only looked at high quality embryos.
So they're not necessarily looking at the full picture.
Exactly.
And for women who maybe are already having some fertility issues, that could be quite a big deal.
Absolutely. And then you've also got the issue of mosaic embryos.
Mosaic embryos. What are those?
So a mosaic embryo is an embryo that has a mix of normal cells and abnormal cells.
Right.
And these are actually more common than you might think. But the problem is that PGT-A can sometimes misdiagnose these mosaic embryos and potentially lead to the discarding of embryos that are actually viable.
Okay, so how are they misdiagnosed then?
So because PGT-A might pick up, it might flag the embryo as being fully abnormal because it detects the presence of some of those abnormal cells.
Right.
So then that can lead to the embryo being discarded, even though actually it might have had the potential to develop into a perfectly healthy baby.
So you could discard a healthy embryo because of this test?
Potentially.
Gosh, that seems like a huge risk.
It is a risk, and it kind of highlights one of the limitations, I think, of this PGT-A testing. And, one of the things that we're learning is that there is this incredible mechanism called self-correction, which happens in many mosaic embryos.
Self-correction.
Yeah.
So it's like the embryo heals itself.
In a way, it pushes those abnormal cells to the outer layer, which is what forms the placenta, whilst the inner cells, which develop into the baby, actually remain healthy.
See, that's amazing. I mean, it's incredible, isn't it? It's like the embryo just knows how to protect itself. But I guess that means that some women, especially, maybe older women who are often encouraged to have PGT-A, they could be missing out on the chance to have a baby because a viable embryo is discarded.
Yeah, and that's exactly right. And that's why, informed consent is just so crucial in these situations.
It really is incredible, like mind-boggling, that an embryo can do that.
Yeah.
And that maybe we're missing out on healthy pregnancies because of a test. It's crazy.
It is. It really highlights how complex all of this is.
Right. Yeah.
These decisions, and why it's so important for people to understand both the potential benefits and the limitations of something like PGT-A.
Yeah, absolutely. So for those listening who are maybe going through their own IVF journeys, what would you say are the key takeaways from all of this? What should they be thinking about? What should they be discussing with their doctors maybe?
I think, first and foremost, knowledge is power in these situations.
Right.
So don't be afraid to ask the difficult questions. So, what's the actual chance that PGT-A will actually increase my chances of success?
Specific chance.
Exactly.
Because obviously we're talking statistics and averages here, aren't we?
Exactly, yeah. And those don't tell the full story for every single person. And I think as well, it's not just about, the benefits. It's understanding the risks as well. Mm. So, be informed about the risks of damage to the embryo during the biopsy procedure. Understand that there is a possibility, although it's small, that a viable embryo could be discarded because of the limitations with the test.
So it's about understanding those limitations, really, just as much as understanding the benefits.
Absolutely. And that's where, genetic counseling, I think, can be so valuable as well.
Right.
Because a certified genetic counselor will be able to provide really personalized guidance.
Right.
Based on your medical history, your family history, and really any concerns that you have as well.
So they can help you weigh up those pros and cons.
Absolutely.
And come to the right Well, the most informed decision for your situation.
Exactly, because at the end of the day, this is such a personal decision. There's no right or wrong. It's about what feels right for you based on the best information that you have.
Absolutely. Well, we've covered so much in this deep dive, and I think what's really clear is that decisions around PGT-A, IVF, they're so complicated.
Yeah.
They're so multi-layered.
Yeah.
And there's so much more to it than just the science, isn't there?
Absolutely.
There's the emotional side, the ethical side. What society thinks, all of those things play into it. So as you move forward on your own journey, just remember that knowledge is key. Talk to your doctors, talk to those genetic counselors, and just as importantly, listen to yourself. Listen to your gut. Thanks for joining us. We'll see you next time.